Hey everyone, happy Monday. I say that every week, but I truly am wishing you a happy Monday. I love Mondays being the start to a new week, a new chance to make it a good one, implement some of the things that we've been wanting to and haven't yet. Hey Tina, you might wonder why I'm in my car, or maybe not. I don't know. I wanted to change the scenery for y'all. Actually, my hubby got home from work early and decided to dive into a bathroom renovation project, and it's like just so noisy and loud. It's reverberating like drills and things in there. So there was no room I could go to, and it's raining here, so I couldn't go outside. So I thought, the car might work. So if y'all can just bear with the rain on the windshield, that's awesome. So today I wanted to talk about the super hot topic of weight loss medications, because it's all the rage, right? I mean, we're hearing about it everywhere we turn, in this group, in other groups, on the news, in the media, in magazines, on Real Housewives, everywhere. So I thought I would just give you my perspective, because I am in the weight loss business. I have been working in weight loss for the last 25 years, and so I've definitely had my experiences with medications and using them, and also in bariatric surgery. And so since y'all have interest in both, and all things weight loss, I thought it would be a good topic for us to discuss and for me to just share a little bit about. So I think I'll start off by talking about the different kind of classes of medications. And the one that's really the rage right now are the injectables. So they're all similar in action. They're what's called GLP-1 agonists. And these are weekly injections. And then there's one that is hey Tracy, that's a daily injection. But they're all in very similar classes of medications. So Ozempic, the generic for Ozempic is semaglutide. That is labeled for diabetes only. So really, in order for you to get prescribed Ozempic, you would need to be diabetic, or your provider would be needing to give you a diagnosis of diabetes in order to get that covered by insurance. Okay, so Ozempic is semaglutide. Now, the obesity labeled medication that is also semaglutide, but by a different brand name, is called Wegovy. So Wegovy you can qualify for with a BMI over 27, with one major comorbidity. So that would be, you would be squarely in the overweight range with a comorbidity, or a BMI over 30, which is technically considered obese without the comorbidity. So Wegovy is Ozempic, except they're by different manufacturers with a different brand name. Those are weekly injections. Now, there's another medication called Saxenda, which is a different generic. It's a daily injectable. It is also labeled for weight loss. So sometimes I have been able to get Saxenda covered where Wegovy was not. It's not semaglutide, but it's something very similar with a similar action. The last one in this class is a medication that has been talked about a lot lately in the past, I guess, year or so. It's called Mounjaro. And Mounjaro is, it's also not semaglutide. It's a different, in the same class, it's called Tirzepatide. Is that generic? There is no weight loss equivalent to Mounjaro, and you can't get it as a generic because it's only been recently approved for diabetes. And in the diabetes study, they found significant weight loss in people who are using Mounjaro for diabetes. And so they went ahead and filed for an FDA approval for an indication for weight loss. So who knows how long that might take for that to come through? It might be 3 to 5 years. I don't know. That's kind of typical for FDA approval, even on fast track. So Mounjaro is, the New England Journal of Medicine published this amazing study on Mounjaro and its efficacy for weight loss. The weight loss results were actually a little bit better than with Ozempic, or the Wegovy, which is the exact same thing, remember. So there's some promise there for Mounjaro, but Mounjaro is only available for people with diabetes. So it would be exceedingly difficult to get this covered by your insurance for obesity. But if you happen to also be diabetic, it's a great option. They've really gotten strict on the rules for Mounjaro. They even ask, a lot of pharmacies will ask for documentation of diabetes. The insurance companies sometimes will ask for labs to verify that. So a hemoglobin A1C that's in the diabetic range, because they're trying to get it, hey Sabine, they're trying to get it approved for weight loss. So they don't want, I mean, there was a period of time, I would say probably about 6 months ago and beyond, where people were using it for weight loss. So they were getting it sent through. I know I used diagnoses of like insulin resistance and things, and I was able to get it through under that. But in the more recent months, they got very, very strict on it. I think there's a concern over shortage, which I do experience in my own practice, where certain dosages are not available. They're on back order. And because of the combination of there being a shortage for those who are actually using it for the labeled indication of diabetes, and what I believe would be, concern that the FDA would shut down their application for weight loss because it was being used inappropriately. So they have really tightened the reins on that. And so in my practice, it's very difficult to get it approved, and I will not mislabel somebody a diabetic when they're not. So that's the scoop on the GLP-1 agonist medications. The usefulness of them is that they have a couple mechanisms of action. Number one is they help increase insulin sensitivity. So for anyone who has been obese, there likely is an element of insulin resistance to the obesity. It's a hormonal disease. It's a metabolic problem. And so those metabolic aberrations like insulin resistance are fairly common, even if you weren't a diabetic, because prior to becoming a diabetic, you can be insulin resistant for 10 or 15 years. It's the primary basis for things like polycystic ovarian syndrome. And so your pancreas will, throw out a lot of insulin years before, in order to lower blood glucose levels. And so your blood glucose or hemoglobin A1Cs are not going to show diabetic for many, many years, because your pancreas is putting out so much insulin to try to manage that. And the cells, the more insulin you're putting out, the cells become more and more and more resistant to it. So yes, so those medications help to improve insulin sensitivity. In my opinion, from just a clinical standpoint, it's probably one of the best benefits of those medications, because that is something that is challenging for the patient or yourself to overcome. Now, it is possible, and there are ways to do it, and that is definitely one of the things that in our coaching or in the bariatric success method, we work to improve that insulin resistance by things like low carb eating, and the most important factor would be by intermittent fasting. And we help people navigate what that looks like and how that's done, effectively. So aside from that, it also decreases gastric emptying, which means it slows down the rate at which food leaves your stomach. Now, there's been no studies to look at gastric emptying in a gastric bypass patient, right? Because your anatomy is different. You don't have the valve at the bottom of your stomach anymore that is signaled by the presence of food and is that opens and shuts. So now your construction is more like a funnel where there is kind of no kind of valve at the bottom that's going to help regulate things. However, it likely does slow things down somewhat and makes your gut a little bit lazy. The tendency for the gastric emptying slowdown tends to be more in the very beginning or as you do a dose increase, and it kind of wanes off over time to be not as profound. But in somebody who has, let's say, gastroparesis or motility of the gut disorders, or has significant irritable bowel syndrome issues, it might not be a good idea to try something that is going to significantly alter your gut. And this is also going to lead to more adverse reactions such as nausea, vomiting, and things like that. So that's the second mechanism. Now, in someone who without gastric motility issues, could be good because it's going to help keep you fuller a little bit longer, right? So we always want that. Don't forget, drinking and eating at the same time. If you're doing that, nothing's going to keep you fuller for longer. Okay. And the third thing it does is decrease glucagon serum plasma levels, both in fasting state and after a meal. And glucagon is one of those hormones in the gut that regulates our appetite and regulates our blood glucose and insulin levels. So that regulating our appetite sounds amazing, right? And so does keeping our blood sugar down, which is why these medications work great in diabetics. Because if you have listened to our webinars or our 5-day live or some of my earlier Facebook live posts about why we need to regulate and control our blood glucose spikes and therefore our insulin spikes for a means of weight loss and weight management after bariatric surgery, you would remember that that is a key methodology for us getting to our weight loss. Because cutting back doesn't work. We've already burned that bridge, right? And now we need to tap into a hormonal method of weight loss that is going to drive our insulin levels to be steady. And we do that by keeping our blood glucose levels steady. Because when our insulin levels are steady, we are not in fat storage mode. We have the ability to use fat for fuel, and that is how we get weight loss. And so those three mechanisms are the main mechanisms of action. And I would say that they work pretty well for most people to help give you an appetite, a little bit of a decrease in appetite, feeling fuller on less food, and feeling fuller longer. And so if that kind of like rings a bell, I do think that it stimulates feelings similar to like 3 months post-op, right? When you weren't that interested in food, you ate a little bit, got full, and that's sort of like the dream, right? Awesome. I know. So the issue with weight loss medications, and I'm gonna talk about a few more weight loss medications, but while I'm on the topic of the hormonal ones, the issue is that it really is just a Band-Aid, and like other medications that are Band-Aids, they might help us mask the problem that we have, but they're not healing what's underneath. And they're not changing things for the long term for us. So like a Band-Aid, when you rip it off before the wound underneath is fully healed, it's going to start bleeding again. And these weight loss medications are the same in effect. So I believe that it's inappropriate, really, to prescribe these medications to any patient, bariatric or not, with obesity, unless the patient is willing and able to work a strong lifestyle behavior program and really understands what is needed for them to heal themselves on the inside. Because in absence of that, these medications are intended to be forever. Because when you come off of them, you get no more benefit. So you get hungry again quicker. You don't get as full as quickly. And so for that reason, I believe that when used appropriately, that means that it's with someone who is getting into understanding how to regulate their blood glucose and their insulin, and using methodologies that make sense to help alter their own body's hormones and chemistry in a way that mimics that of the weight loss medication. Because I have been very successful in helping people who were on the medications, who used them as a push. It's like using it as like a shove to help you really implement these lifestyle behaviors and really help alter your own physiology. And so it made it a little bit easier for them to make the changes that they needed to make. And then once they were really understood, they were into the lifestyle, they had all of the kind of behaviors in check, they were really confident they knew how to eat low carb, they knew how to balance their blood sugars, they knew what foods took them in and out of weight loss, they knew what intermittent fasting was and how to do it successfully and all the tricks that were associated with that, and they were using that. Not only did they get great weight loss benefit, but they healed what was underneath. And so they were able to mimic the same benefits of the injection as the injection was weaned back and off. Because now you have the same benefits without the medication, and you are able to continue them going forward. So that's my belief. Because if you just don't change anything and you get on the medication, you are going to have some benefit from it, but you're going to be on that medication forever, or you're going to be faced with another kind of failure on your record, so to speak, right? And how many of these weight loss yo-yos and failures can we really, handle in a lifetime? So that is my philosophy on them. I really believe that you need to, because really, a Mounjaro, Sabine saying she did great on it, and it was the kick she needed. And I believe that that's true for a lot of people. But if you think about it, these weight loss medications are akin to having bariatric surgery. Or let's say in our case, who've already had bariatric surgery, a revision. So you see people like, oh, I gained weight, I need a revision. It's the same thought process. It's the thought process of, well, my surgery isn't working, I need the next thing. And what we should be really thinking about is, are we working our operation to its fullest capacity before we jump into a medication or a revision? Because if we don't change our lifestyle and we don't grasp that we need to understand what's involved to balance our hormones so we can forever maintain, so we can forever have a tool to help us lose when we need to, then we're gonna always be at the whim of the next thing and not have that good knowledge behind us. So let me go back to a little bit more about the medications. Some of the risks associated with those injectables, gallstones. I mean, anytime we're gonna be losing weight, gallstones is a risk. So, I mean, I kind of take that with a grain of salt. Pancreatitis, that's kind of a low risk, right? But, pancreatitis is pretty shitty when you have it. And concerns over tumors and cancers of the thyroid. So might be prudent to kind of get your thyroid checked prior to starting those medications with like an ultrasound, especially if you have a history of thyroid cancer or family history of thyroid cancer. Some of the other more common side effects: nausea, vomiting, diarrhea, constipation, your typical abdominal, concerns. particularly vomiting, because if you overeat using these medications, you likely will get very close to throwing up, if not throw up. So when you're on them, you don't push it too much. You get that sense, you're aware, and you stop. So that is kind of all a lot of people want to know about insurance coverage. So I covered what qualifies you. There's another component to insurance covering these medications for weight loss, and that is simply you either have a rider for weight loss medications or you don't. Very similar to bariatric surgery, but interestingly, not the same rider. So just because you had a benefit for bariatric surgery does not mean you have a benefit for weight loss medications. It's a separate add-on to a policy. It's called anti-obesity coverage. So if you wanted to contact your insurance company to find out if you were covered for those medications, you would ask if you have coverage, if you have an anti-obesity coverage. And that is how you kind of find out about that. If you don't have the coverage, you don't have it. If you have Medicare, you don't have it. Medicare, back when fen-phen, all those years ago, I guess like in the, 70s, 80s, when fen-phen was being used for weight loss, and it came out to be causing heart defects, Medicare made a ruling that they were no longer covering weight loss medications, and they've never reversed that ruling. So there is no coverage by means of Medicare for any weight loss medication. Aside from getting it covered from your insurance, these medications are very expensive. Even if you use something like GoodRx or something like that, you're still looking at upwards of $1,000 a month. And knowing that in all these medications, you have to really titrate your dosage up. So you start at the lowest dose and then you go to the next. And there's about 4 to 5 months of where you're building up to the max dose or to your max dose where it's easily tolerated and you're doing well losing weight on it. So you're looking, at an extended period, a good amount of time, even until you're at max dose. So for out of pocket, for a lot of people, it's kind of cost prohibitive. There are weight loss clinics and places online that do compound semaglutide, and so that means they get it from a compounding pharmacy and they will administer the injections in their office. That's a personal preference. The FDA recently put out a statement, and so it's kind of been on the news and in the media a lot about compounded medications are not the same. Because you're not getting it from a straight up pharmacy like Walgreens, do you really know what you're getting? I know from my functional medicine world that there are a lot of great compounding pharmacies that do have quality checks and are very, up and up. But so in that scenario, sometimes you can, get the semaglutide compounded for a little bit lower cost, but you're still looking at, $300-$400 a month. So that is those medications. There is one more weight loss medication that I do use, which is a little bit easier to tolerate the cost if you don't have coverage, and that is called Contrave. Contrave is a combination of Wellbutrin and naltrexone. So this is a really interesting one because naltrexone is an opioid receptor blocker. It's used in alcohol dependency and opioid dependency because it blocks the receptor so that when you consume those substances like alcohol or like an opioid, you don't feel the effects from it. And so effectively, it decreases the cravings for them, and you don't get that dopamine hit from taking part in those substances because your body's being blocked from it. So I find it really fascinating that such a medication would work for weight loss, but it makes perfect sense, right? Because now we have clear, this makes so much sense because food is addictive, right? Especially sugar and flour. Those white, refined, products that in the wild, such as, wheat and sugar cane, are not highly addictive substances, but once you refine them, they become so. And the same is true for many drugs, like cocaine. It's the refining that makes it so addictive. So, anyways, it works the same for food in that it doesn't give you that dopamine hit, make you feel as good, and decreases cravings. So it's good for use in people who have a very high emotional eating, who are really kind of high carbohydrate cravers. And I especially love it for people who've experienced weight gain and are consuming a little too much alcohol, maybe binge drinking or nightly drinking, because it works well to decrease both cravings for food and cravings for alcohol. So if alcohol is playing a role in your weight gain, this could be a really nice option. The Wellbutrin is an anti-anxiety, antidepressant, and so it can be really great for people who kind of like are just kind of always looking for something, because it's like helping them to calm themselves, because you're getting the benefit of that Wellbutrin to help you in managing some of that anxiety as well. The downsides to Contrave are that some people are very they have poor response to Wellbutrin, and it can cause nightmares, brain fog, slowed thinking. And so you either know that because you've tried Wellbutrin in the past and it was hell, or you know that when you try it and you start to feel very strange and not like yourself. And that just means you can't tolerate that medication and have to come off of it. For the majority of people, though, I would say, the risk of an adverse reaction like that is probably 5% or less that I've seen. For most people, they feel great on it, and it is helpful. Not as powerful as the injectables, because and not helpful in managing metabolic disease. So Mounjaro is really good for, or Ozempic and in the GLP-1 injectables. They're really good for people who have like issues with insulin resistance and cholesterol aberrations and things like that, because it's going to be more impactful from a metabolic standpoint. Whereas for just your like grazers, carb cravers, sweet cravers, maybe some too much alcohol in the lifestyle, the Contrave could be a good option. Probably the only other medication that we really kind of use in weight loss is phentermine. I don't prescribe phentermine. I just don't care for it, because it's just it loses its effectiveness very quickly. Usually after 3 months, its effectiveness has dropped off and it's non-existent. It raises blood pressure in a lot of people, and it is it's an addictive substance. So we have to cross-check for the registry of controlled substances, and we have to prescribe it specially, and we have to have like a special DEA license to be able to even prescribe it, because it's in the level of like Percocet. So it is very highly addictive, and it doesn't really work that well. So I figure like the risk-benefit ratio is just not there to use it. It is cheap though. You could probably get phentermine for like $40 a month or something like that. Contrave you can get for under $100 a month for that prescription, even as a cash pay. So that is kind of the skinny on weight loss medications. Just to kind of summarize, I definitely believe that because I am both a traditional practitioner as a nurse practitioner and a functional medicine practitioner who, functional medicine tends to really rely on healing what's the root cause of things. We use food, we use supplements, we use stress management and sleep and all of these lifestyle factors to get to the root cause of things. I do have like the combination of both, right? So I do believe in both. I believe that we have to give medications, and allow access when there is a benefit to the patient. However, I also believe that we're doing the person an injustice if we say, got this great medication for you, it's going to fix your problem, and we don't teach the patient how to heal what the real root cause underneath is. And that is just not understanding what lifestyle factors really make a difference to their physiology, because I want to give people the tools so that they are an expert at weight loss. And if part of that toolbox is a medication for a little while, then okay, but you have to become an expert at how to lose weight. And barring that, you're on a medication with risk factors and side effects and is costly, not to mention all of them have distribution issues. So you will run into problems getting access to the medication at some point. So, there are downsides, of course, right, to medications. And so we just want to go into it. If it's something we want to consider, just really being informed about it and really having a plan for using it as an adjunct to help you make and sustain the changes that you really just need to make from an internal standpoint, so that going forward you have those tools that you don't always need medications to lose weight. You don't always need to consider a revision anytime you want to have some weight loss. You know what to do. And that's what I believe is the best approach. It's treating the whole person. And that's what we do in the Bariatric Success Method. Make you an expert in your procedure and in weight loss. So that is it. Let me see if I have any questions. Anybody have any questions you want to pop in? Sabine, you're like, you did it backwards. Not, you got the medication first and now you're working on the lifestyle. But I think that's okay too. Because, when you know, you don't, when you know better, you do better. So wherever we are in our journey, I think it's never too late to learn. We're all just a work in progress, and we have tremendous amounts of work to do on ourselves. So kudos to you for doing it. Yeah, it's working. You're so awesome, Sabine. Thanks for coming today. And thanks, Tina. So does no one have any questions? Did I really cover what was burning on your brains today? I know there's not a whole lot of people here today. A lot of people let me know that they were working. So in the comments, if you're watching this on the replay, make sure you let me know that. And if you have any questions, type it in there. And I'll try and keep coming back to check them. All right, well, I guess that's all. I am... Thank you. I am headed off to Reiki, my Monday ritual. So I'm going to... Oh, Kathy, you know what? The best way to contact me is I will post a link right now here. I switched platforms a little while ago, and so in that, my calendar and my scheduling system and everything, I'm using a new one. So you probably have an outdated link from somewhere, something old that I posted, and that's why you're having trouble with it not being found. And so I will pop in a link so that you can book a call. You can always email me too, Whitney at thebariatricsuccessmethod.com. And this is funny, I can't get back. I left the screen. Oh, here it is. Okay. And Kathy, let me know. Just send me an email if you don't find a time there that works for you. I'm a little full in July, so if you can't find anything, we'll work something out privately. But I hope you all have a great week, and I will see you next week. Kristen and I are doing a coffee chat. So it will be a great, just kind of low-key, casual chat because Kristen is, I think she's here today. She is new as a team member to the Bariatric Success Method and to this group of the Weight Regain Solution Seekers. She is a success navigator, so she is really helping me as as the group has grown to almost 4,000 people. I love creating content and I love engaging, but it's very difficult for just one person. So she is going to help me in having these awesome conversations. She is a bariatric patient. I've worked with her for years in the past. She's an amazing person. She is also going through the Bariatric Success Method, and so she has the inside scoop on how it all works and all of the things. So her and I are going to chat next week. I think we're going to do it a little bit later, so I'll post the details, but something like 5 o'clock. And we're just going to talk about our journeys and like where we've run into barriers and roadblocks and like how we overcame them, and just kind of get to know Kristen a little bit. So I look forward to that. Next Monday I will give you all the details sometime this weekend. So I will see you then. Bye guys.